Hello everyone! My name is Jonalyn. I'm with Ariel and Angel. This video is presented by San Joaquin Delta College nursing students. In this video, we will be discussing asthma specific for adults. Asthma is a chronic respiratory condition characterized by inflammation and narrowing of the airway, leading to difficulty in breathing. The pathophysiology of asthma is complex and involves airway inflammation results from an immune response to allergens activating inflammatory cells like mast cells and eosinophils. These cells release mediators such as cytokines and histamines leading to edema and increased mucus production. This narrows the airway and enhances their reactivity, contributing to chronic inflammation and structural changes known as airway remodeling. Intermittent airflow obstructions occurs due to bronchoconstrictions, edema, mucus accumulations, often triggered by allergens or exercise. This obstructions leads to acute breathing difficulties and typically reversible with bronchodilators. However, repeated episodes may cause permanent airway changes resulting in fluctuations between normal airflow and significant respiratory distress. Bronchohyperresponsiveness is an exaggerated bronchoconstrictions response to various stimuli indicating increased airway sensitivity in asthmatics. This condition is closely linked to underlying airway inflammation and often correlates with the overall severity of asthma. Now I'm going to talk about the asthma prevalence in San Joaquin County. Overall asthma prevalence is approximately 10.4% adults aged 18 to 64 have asthma, and about 8.4% are reported to have asthma in older adults to 65 years and older. For hospitalization, there are roughly 500 asthma-related hospitalizations each year in the county. The hospitalization rate for asthma is approximately 15 per 10,000 populations, and as for deaths, there are approximately 8 to 10 asthma-related deaths per year in San Joaquin County. This represents a mortality rate about 0.25 per 100,000 population. Risk factors include genetic factors such as family history of asthma or allergies, environmental factors like allergens, exposure to pollens, mold, dust mites, and pet dander can trigger symptoms. This also includes irritants like tobacco smokes, air pollution, and strong odors. Viral respiratory infections in early childhood can increase asthma risk, and obesity and excess weight is linked to a higher risk and worsen symptoms. Some may experience exercise-induced bronchoconstrictions from doing physical activity, certain occupation exposing individual to allergens or irritants. Also, asthma can develop at any age, often starting in childhood, and women may experience more severe symptoms in adulthood.
So what are the signs and symptoms of asthma? People with asthma will experience dyspnea or shortness of breath. They will also experience frequent coughing, which can cause trouble sleeping. They will also experience chest tightness and chest pain. High-pitched wheezing and also diminished breath sounds can be heard on auscultation. Some people with asthma will also be using accessory muscles due to increased work of trying to breathe. Here's a video where you can listen to what high-pitched wheezing sounds like. So what triggers asthma exacerbation? Allergic reaction to pollen, pets, mold, spores, cockroaches, pet dander, and dust mites can trigger asthma exacerbation. Air irritants such as chemical fumes, gases, dust, cigarette smoke, and air pollution can also increase the risk of an asthma episode. Respiratory infections such as colds, influenza, respiratory syncytial virus or RSV, COVID-19, pneumonia, and sinusitis or sinus infections can also increase the risk of exacerbation. Dry wind, cold air, hot air, or sudden changes in weather or temperature can sometimes bring on an asthma episode. Exercise and physical activity also contribute to asthma exacerbation, and this is called exercise-induced asthma. This is when you experience shortness of breath during exercise. Your airways become tight, narrowed, and inflamed during physical activity. This happens because you breathe dry air during exercise, causing you to lose heat, water, or both from your airways. Medications such as NSAIDs, aspirin, and beta blockers can also increase the risk of an asthma exacerbation because they trigger the immune response leading to constriction of the airways. Lastly, non-compliance with medications and treatment can also cause asthma exacerbations. So now I'm going to talk about the different diagnostic tests used to diagnose asthma. First is the pulmonary function test. This includes the peak flow meter, spirometer, FeNO test, and provocation test. The peak flow meter measures how well air moves out of your lungs. Using the peak flow meter daily can help spot reduced airflow before you notice the signs and symptoms of an asthma episode. Spirometry is the most recommended test to confirm asthma. During this test, you breathe into a mouthpiece that's connected to a device, and this measures the amount of air you're able to breathe in and out and its rate of flow. You will take a deep breath and then exhale forcefully. The FeNO test, also called exhaled nitric oxide testing, helps measure the amount of inflammation in the lungs. When you have asthma, your airways become inflamed and produce nitric oxide. This test can tell how much inflammation is in your airways by measuring the amount of nitric oxide. Provocation test is a test that tells how sensitive your lungs are by using irritant triggers, or by making you do an exercise or a physical activity. Imaging tests can also be used to diagnose asthma, such as a chest X-ray or a CT scan.
For nursing management, the nurse will generally listen to your breath sounds to check if the air is moving properly through your lungs. It helps them hear if there are any problems, like wheezing or blocked airways, which can show if your asthma or breathing issues is getting worse. They use peak flow to measure how fast you can blow air out of your lungs. They use pulse oximetry to measure the amount of oxygen in your blood, and other vital signs such as blood pressure and heart rate are also taken. Nurses will also obtain a history of allergic reactions, identify medications you are taking, and they would administer medications as prescribed, and they would also monitor the responses to those medications. This medication may include an antibiotic if you have an underlying respiratory infection. Nurses will also administer fluid if you are dehydrated. There are no cure for asthma, but it can be managed by taking medications as prescribed. The second one is avoiding or limiting asthma triggers such as pet dander, tobacco, or dust, etc. The third one is changing of your lifestyle. It can be just engaging in a low-impact exercise such as walking, swimming, yoga. So trying to get plenty of sleep, finding ways to manage your stress, trying to eat healthy food, and staying hydrated as much as possible will help you better manage your asthma. You should monitor how often you experience your symptoms such as coughing, wheezing, or shortness of breath. You should also know how to the proper way of inhalation technique and how to use an inhaler properly. You should also know the symptoms that needs immediate medical attention, such as chest tightness, continuous shortness of breath, like taking 30 minutes or more breaths per minute and not relieved by inhaler. Your lips or fingernails are turning blue. You're unable to complete a sentence without pausing to take a breath. You feel agitated, confused, or you just can't concentrate. And you're also trying to bend your shoulder forward just to breathe easily. For community resources for asthma patients, we have Health Plan of San Joaquin. They have asthma condition management programs. So what they do is they provide tips for preventing asthma attacks and maintaining a healthy lifestyle, which can help reduce hospital visits. You also learn the proper way to use your medications and understand when to take them. Videos on how to use inhalers and peak flow meters are also provided on their website. The second one is called Central California Asthma Collaborative, or CCAC. They operate different programs, and one of them is called Comprehensive Asthma Remediation and Education Services, or CARES. They provide education about asthma and supports patients by facilitating and reinforcing regular visits to a healthcare provider. The third one we have is Asthma Education and Support in Stockton Sutter Health. They provide educational workshops and also a one-on-one consultation.
It's important to use your inhaler correctly. Some people benefit from using a spacer with their inhaler, which can slow the delivery of the medicine. Shake the inhaler 10 to 15 times, and take the cap off. Breathe out all the way. Put the inhaler or spacer in your mouth. Press down to release the medicine. Breathe in slowly for 3 to 5 seconds. Hold your breath for 10 seconds. Breathe out slowly.
It is generally recommended to rinse your mouth after using an inhaler. This is because it can leave a residue in your mouth and throat, which can potentially cause side effects such as oral thrush and hoarseness. And that concludes our presentation about asthma specific for adults. Thank you.